Good.
Okay, I'm just going to look at your hands.
Okay.
See if there's any color changes or any other abnormalities. Okay, and now I'm just going to check for capillary refill. Okay, and now I'm going to palpate the radial artery bilaterally.
Okay.
Okay, and then could you lay down for me? Just going to look at your legs for any color changes as well. Also checking for the hair distribution. Okay, now I'm going to check for pitting edema over the tibia. Okay, and now I'm just going to palpate the dorsalis pedis bilaterally. And also the posterior tibial bilaterally behind the medial malleoli. Okay, and now I'm just going to evaluate for JVD.
Okay.
If this table would, I would, or if it would elevate, I would have it at about 45 degrees. But
Okay.
since it can't do that, I'll just have you look that way for me.
Okay.
And just inspect it. Okay, and now I'm just going to auscultate your carotids. So if you could just take a deep breath and hold it for me. Okay, and let it out.
Okay.
And then just look this way and take a deep breath and hold it. Okay, you can let it out.
Okay.
Okay, now I'm just gonna listen for your heart sounds.
Okay.
Okay, and can you lift your breast for me? Okay, and can you turn on your left side for me?
Yep.
I'm just gonna listen to the heart sounds again. Okay, and if you don't care, could you lift your breast for me again? Okay, and just keep it lifted. I'm just going to palpate in that same area for the PMI. It's about at the 5th intercostal space, medial to the midclavicular line.
Okay.
Okay, and it's right there. Okay, now I'm just going to have you sit up.
Okay.
And I'm just going to listen to your lung sounds now.
Yep.
Each time my stethoscope touches your chest, do you care to take a deep breath in and out of your mouth? Okay, and just turn around for me.
Okay.
And if you don't care, just lift this right arm.
Okay.
Okay, and a deep breath in and out. Okay, and I'm just going to do the same thing here on your back, okay?
Okay.
In and out of your mouth. Okay, and now I'm just going to perform a structural exam.
Okay.
So I'm just going to palpate down your spine and see if there's any restriction in motion.
Okay.
Okay, and I'm just going to do the same thing on this side.
Okay.
Okay, and I did identify some restriction in the T2 to T4 area on this side.
Okay.
Now I'm just going to have you lay flat for me if you don't care.
Okay.
And I'm just going to listen to your abdominal vessels.
Okay.
It'll be 3 points above your belly button and 2 below.
Okay.
Okay. And I can help you sit up.
Okay.
Signs of distress or any abnormal breathing. I'm going to look at the shape of the chest and the movement. Just make sure that's good. And then I'm going to look at the trachea, make sure it's midline. And I'm just going to have you swallow. Okay. And now I'm just going to look at your upper extremities, check for any signs of cyanosis, as well as any clubbing of the fingers. Okay, and then I'm going to auscultate your lungs.
Okay.
So each time my stethoscope touches your chest, do you care to take a deep breath in and out of your mouth?
Okay.
Okay, and do you care to turn around for me? Okay. Okay, and do you care to lift this right arm for me? Okay, and take a deep breath in and out of your mouth. Okay, and then same thing back here, in and out of your mouth. Okay. And now I'm just going to percuss over your lungs. I'm just going to put my finger on your back and just do this and just check for any abnormal sounds, for any dullness or anything in your lungs.
Okay.
And I'm going to do that on the same areas that I auscultated in.
Okay.
Okay, do you care to turn around for me? I'm just going to have you lift this arm.
Okay.
I'm going to do it under here.
Okay.
Okay, and then I'm going to do it on the front.
Okay.
And it's a little more dull on the left side due to your heart, but that's normal.
Okay.
Now I'm just going to have you turn back around.
Okay.
And I'm just going to perform a structural exam. So I'm just going to palpate down your spine just to make sure there's no restrictions or anything.
Okay.
I'm going to do it on the same side.
Okay.
Okay, and I did find a little restriction here in the T2 to T4 area on this side.
Okay.
Now I'm just going to assess your ribs in breathing. So I'm just going to place my fingers here on the rib heads. And I'm going to get you to take a deep breath in and out. I'm going to come down and do it one more time. Then I'm going to come on the sides here and have you breathe deep breath. And then one more time. Okay. And now I'm just going to perform a special test. I'm going to put my hands on your back and I'm just going to have you say 99.
Okay.
And I'm just going to be observing for any abnormal vibrations, okay?
Okay. 99. 99, 99, 99. And now we're going to listen to the heart sounds. We're going to listen to the apical, pulmonary, Erb's point, tricuspid, and mitral valves with the diaphragm first, and then we're going to listen with the bell. And with the bell, we would be noticing if there was any murmurs or gallops. So we're going to start the first time. You can breathe regularly. Sorry. All right, and now we're going to listen with the bell. All right. S1 and S2 are noted, regular rate and rhythm. No murmurs or no gallops are noted. We're going to move to the back. We're going to start by just assessing. We're going to also assess the scapula while we're here. Can I ask you just to reach down and touch your toes really quick? We're just going to look to see if the spine is symmetrical and there's no showing of scoliosis. All right. And we're going to just palpate really quick. Just tell me if you have any tenderness. Any tenderness? No. All right, while we're here, I'm gonna put my hands on about the 10th rib, and I'm gonna ask her to take one deep breath, and we're gonna see if her lung span is symmetrical. You can breathe in. Okay, release. All right, it's symmetrical. And we're going to percuss. We're gonna listen for resonant sounds. I ask you to just pull your arms forward just a little bit, just so I can get your scapula out of the way. Now we're just going to listen. Take a deep breath. All right, no adventitious sounds noted, all regular rate and rhythm. And if I were in a scenario where it was just the privacy of me and the patient, I would have actually put the stethoscope on the skin of her chest so that way I can hear all sounds, and making sure that I'm ruling out not having the stethoscope on her clothes and making sure I'm hearing everything correctly. But for the purposes of this is why we have just a jogging bra. And one on top of it. All right, I'm just gonna ask you to lay down really quick. And before we start the actual stomach, I'm gonna just look at the neck again. We're gonna revisit the JVD, and we're just looking to see if there's any jugular vein distension. We're looking on both sides, and I'm just gonna ask you to just kind of sit up really quick. This spine's at about a 30-degree angle, and I don't see any JVD distension on either side, so now I'm gonna ask you to just lay back down. All right, awesome. So now we're gonna start with the abdominal area, and we're gonna look for any pulsations, any hernias, any lesions, any mass, if she had any wounds, if she had any G-tubes. And before we do anything, we're going to auscultate. We're going to auscultate with the bell, and we're going to listen for any bruits. So we're going to start with the abdominal artery. We're going to do the renal arteries, and we're going to do the iliac. I'm just going to pull down a little bit, which is about right here. Okay. All right. no bruise or noted. And now I'm just gonna listen with the diaphragm. I'm gonna listen for her vowel sounds. Sorry, got all tangled. All right, we're gonna listen to all 4 quadrants going in clockward motion. Alright, vowel sounds noted in all 4 quadrants. We're going to do a light palpation. We're going to see if we feel any rigidity. We're going to also see if she has any tenderness. So just let me know if you have any tenderness, okay? We're going to start with a light palpation. Any tenderness? Nope. Alright, now we're going to do a deep palpation, okay? Feeling for the same things. No pain? Nope. Alright, so no pain, no rigidity. We're also now going to percuss we're going to do the liver, which is on this side, and then the spleen, we're listening for tympanic sounds, and if there's any dual sounds, it would show that there's probably fluid.